All right, hi there. It is Monday. We start a new week, November the 16th, with a visit on our daily briefing with Dr. Sanders today, because some things are moving around on the dashboard a bit. We want to get her perspective on that, and then also some information she has about new recommendations regarding travel. Your daily briefings on the radio, KLAM and KCDV, in the 1, 5, and 8 p.m. hours. Uploaded then as soon as we can to youtube.com/Cordova TV. All right, Doctor, let's start locally. Some changes on our dashboard. What's going on here now as far as Cordova?
Great. So we have had 2 new cases identified over the weekend. They are related to one of the cases that was identified toward the end of last week. So right now we have 3 active cases that are all related, and we had 2 recoveries. So we continue to see Cordova do a good job at managing these cases and isolating them and not allowing the virus to find another host and spread in our community. And I just want to commend the community for doing that. Keep doing what they're doing because we're managing this.
Okay, and it's good that you point out that there were, in addition to finding 2 new cases, there were also 2 recoveries, because if people look at the dashboard, it's still going to say 3 active cases. So 2 moved off, and then two were added. So that will presumably stay at 3 for a little while, maybe drop to 2 soon, I guess. Go over again, for anybody that might have missed it, the nature, again, without obviously divulging a person's identity or situation, but there is a hospitalization on our dashboard, which could lead somebody to the wrong conclusion about the nature of it if they didn't know better, I guess.
Yeah, certainly. So we do have a patient hospitalized that was hospitalized for other reasons, and so they were not hospitalized because of COVID. They were hospitalized for other reasons. However, of course, anytime you have a fragile individual that is hospitalized, that is, and when they have COVID, it makes them even more at risk and more fragile. So the hospital, the staff here are absolutely doing an amazing job managing this case and using PPE and making sure that we protect ourselves as well as the community. And so that case, although we do have a COVID hospitalization, it hasn't changed our local alert significantly, although certainly anytime there's COVID in the hospital and in the community, we are really paying close attention.
Sure. And is it likely, again, even though the COVID is sort of a tangential issue for this hospitalization, is it likely that same philosophy will then apply to our fatality count? If this person was to pass away, would they technically be listed as a COVID fatality also?
Well, I think that we've seen this kind of throughout the country play out with these numbers. Anytime you have a fragile individual, even during flu season, if a fragile individual ends up catching influenza and passing away, that would be counted as a flu death. And so COVID-19 is no different. Certainly when we have fragile people, those numbers do get calculated into the COVID numbers. But at this point, we're watching those numbers and don't want anybody to panic if our numbers do change, but don't necessarily, know what's going to happen any day. So we're watching closely.
Well, speaking of hospitalizations and state numbers and so forth, how is Alaska doing in terms of healthcare capacity? Because that's always an area of concern.
We certainly have seen that the state is having increased ICU utilization, increased ventilator utilization. Their vent and hospital bed capacity does remain okay in Alaska. One of the things that we're finding, though, is that we're having difficult times with staffing shortages due to high numbers of staff being in quarantine. Even in the hospital here, we've had some positions that are just difficult to fill because there are so many healthcare workers in quarantine. So we're all paying close attention to staffing And right now we are in good shape, but it doesn't take much to change that status.
Yeah. Well, the state overall, I mean, it's always hard to know because this is a new, still technically a new virus, and we haven't completed a year yet with dealing with it. But compared to how the state was doing, Alaska's getting walloped right now. I think we had just shy of 1,400 new cases between Saturday and Sunday. So, I mean, I assume you're continuing to participate in meetings and this, the status of Alaska as a whole is particularly important to Cordova if there are any considerations about going out of town or people coming to town for the holidays or something. So what's the look from your position regarding the state overall?
Absolutely. So we do see things blowing up in the state, and I think that's what preempted some of the changes in the guidance from Dr. Zink. The current guidelines ask that anybody that's going to be traveling to a community that's located off the road system to get a test 72 hours prior to arrival. So for Cordova, what that means is anybody that's traveling into Cordova, whether it's from Alaska or from the lower 48 or internationally, has to have a test 72 hours prior to arrival. In addition, one of the things that we are seeing is those early tests are not catching the virus, and people will come down with illness day 3, 4, 5. The kind of gold standard best practice is to get a second test after 5 days after arrival. So our ask to people when they're coming into the community from anywhere is to test before you get here, self-isolate or strict social distance. The strict social distance is essentially a quarantine. We ask people to not go indoors with non-household members, use curbside pickup. So strict social distance for 5 days after arrival, and continue that quarantine until you receive a negative test result. We're asking people to come and get that test sometime between 5 and 14 days after they arrive in Cordova.
Okay, so that's kind of similar to what the state has been doing with out-of-state travelers. Now that protocol sounds like part of that's moving in-state. And you had more there?
Yes. We also are just asking Cordovans to please consider not traveling outside of Cordova if it's not necessary. So any non-essential travel, we're asking people to consider waiting and delaying those trips until they can safely go, and that way when they return home, it protects our community. In addition, we're asking people that are coming into Cordova, if you don't need to travel to Cordova, please don't come to Cordova right now. Please wait and delay that trip until either we have a vaccine or things have slowed down or the testing capacity is a little bit stronger everywhere. Our testing capacity here, although we still have the ability to do local testing, the supply chains are slow because there's such demand globally for these tests, and we don't anticipate being able to get more tests. So we're really asking people to help us protect our testing supply. Come and get a test after you travel at that sometime between day 5 and day 14, and strict social distance until that time. We're really going to need the entire community to celebrate a little bit different these holidays and just work together to continue to mitigate the risk for Cordova.
Well, as usual, it sounds like it's very much in our hands. I mean, again, it's amazing to think back. We got through the whole summer with all of the traffic in and out really very successfully with no significant outbreaks. And then, a lot of the passing of the virus has been, us doing it to us. So we've seen that we can be very successful, I guess, if we do these things, and we see that it can rapidly get out of control if we don't. So it'll be interesting to follow up. I'll do some follow up on the travel, the changes to travel recommendations. And in the meantime, any other additional advice for the community as we wrap up?
No, I really appreciate the support. This is an incredibly challenging year for everybody, and I continue to see Cordovans supporting each other, finding new ways to celebrate, finding new ways to make all the holidays and that time special, and I just really appreciate everything everybody's doing.
Yeah, well, Halloween was great, and there's no reason to expect that creativity couldn't possibly extend to Thanksgiving or certainly around the various holidays with Christmas and if people are also celebrating the Jewish holiday, Russian Christmas, all the different varieties of that during that time of year. So we hope folks will continue to be creative and kind as you have been recommending, and thank you and the team for your continued work on all of this.
Thank you.
Yet another informative chat with our very own Dr. Sanders on today's Daily Briefing. Again, if you look at the dashboard, particularly at the highlighted numbers of active cases and whether they're resident or non-resident, you'll see that the number is the same. When you combine that with the announcement that there are 2 new ones, you might be led to believe that they're behind on the dashboard. That's actually not the case, though, because we simultaneously had 2 new active cases and 2 recoveries. Again, if you missed it, these cases appear to be related to the previous batch. So it doesn't sound like community spread, which is always good news. And we'll continue to keep you up to speed, like we said, as travel recommendations or restrictions change and so forth. That's part of what we always try to do with the briefings here. You hear them on the radio at 1, 5, and 8. And then youtube.com/Cordova TV for online listening a little bit later on, as soon as we can get them up there. COVID-19.cityofcordova.net is your best place to get information on Cordova's response. The key phone numbers to utilize are 424-INFO to reach the city, 424-WELL for the Native Village of Eak's pre-recorded information. And we'll see you for the next briefing next time on AM 1450 and 100.9 FM.